My first laser treatment, I did a little dance down the hall. It was the first time I could move my feet together.
Yes, if I remember right, you were able to stand up straight.
That is exactly right, doctor.
Yeah.
It's one of the best things that ever happened to me.
Great. Dr. Hassan is with us today.
I hurt my back doing the bicycle, exercising. I could not walk on Wednesday. The pain started later that evening. Thursday, I could not walk. I called Dr. Erickson. I had to come in. After my first treatment with the laser, that night I saw a difference. I could at least, when I sat down, I didn't need as much help to get up. And when I sat for a long period of time, I didn't feel the pain like I did before. I went on a second treatment. My pain level went from a 10 to, I put a 3 down. Today I came in and I put a 0 on there with my pain level.
My back feels the best it has felt in 20 years.
I've had back pain all my life, and so finally I had that pain for about 4 months before deciding to do it. And after I did 6 treatments, and after the 6 treatments, my lower back was completely great.
Well, I'd had a lot of lower back pain, and we did the laser, and it has been great. I'm not suffered with the lower back pain anymore. I mean, it's been amazing.
Well, I was in an extreme amount of pain. I had tried many other avenues and found no relief. And it was recommended that I come here because of the fact that y'all did do the laser therapy. And I started that, sort of questioning, not really understanding it totally. But after y'all explained it and I've actually tried it, I'm very, very impressed with it. And I just cannot believe the results that I have received and have benefited from the laser therapy. And I definitely would recommend it for anybody that is in severe pain to definitely try it.
Well, my hip was bothering me for weeks, and I've tried all kind of methods to fix it, and we couldn't. And doctor called my physician and got permission to use the laser on me. And since then, I've had minimal pain. The pain was high, was 8 to 10. Now it's maybe 0 to 1 at times.
So, and it's remained in good shape since then.
Shape, yes.
And I think we stopped treatment a few months ago, right?
Mm-hmm.
Okay, when we ended.
Yep,
okay,
months
great.
ago, and it's been great ever since then.
Yeah.
So,
how long have you been pain-free with your back?
Ever since you did the treatment, so it's been almost 2 years.
That's right. And for how long had you suffered with this chronic back pain?
Ever since I started coming to you in the early 1990s.
You know, your orthopedic surgeon is the one who referred you to me.
Yes, that's correct.
Yeah, he has a lot of confidence in our laser therapy and our chiropractic care.
So I used a different kind of laser that Dr. Erickson has. I noticed as soon as I got up from the table, usually when I get up, I will feel a little pain. I feel no pain. I can turn, I can twist. It's completely fine.
What do you think your fellow medical colleagues would think about a treatment like that?
I think it would be great because I know in my profession that I worked with before, they were using a lot of drugs for pain. They had so many of the patients on pill line, giving them Neurontin and for all their different pains. I think that would help cut down on using pills and using pain medication.
It's wonderful. If anybody that is suffering in pain, I would highly advise them to try it.
And we look forward to keeping you well.
Thank you.
Well, thank you, and I appreciate all the work and the effort and everything that y'all have put in me, and I believe it definitely has made a difference.
Great. Thank you, Deborah.
It's probably the most transformative modality to come down the medical pathway in the last 50 years.
What we're finding is 90% of our patients are achieving almost 90% relief of their symptoms, which is unheard of.
Can you straighten it?
Yeah. Dr. Ronald Letterman is an orthopedic surgeon. He runs a busy practice in this medical building just north of Detroit.
This dual action, low energy light laser actually increases the mitochondrial activity of the cell. What that means is it creates a supercell which promotes healing. So now, not only are we offering this laser for patients to eliminate painful conditions, and some of these patients, by the way, have called us to cancel scheduled surgeries. But we're also offering it to patients who have had surgeries, and we're finding that they're healing faster. My best guesstimate is that we are seeing a 50% reduction in the healing time.
You start reading the science behind it and all the different outcome studies, and you say, gosh, this thing maybe works. And so we brought it into our clinic, and we started seeing patient after patient responding with almost too good to be true. You see someone that has such debilitating pain and 1-2 treatments, and they're 80-90% better. So it's been really miraculous.
One of those miracle patients is Tony Gamby, who endured severe ankle pain for 8 years.
After the first 7-minute treatment, I was completely without pain. I was smiling all day long because I hadn't walked without pain in a long time. And I can't wait to send other people in here to get the same benefits from it. I would spend the same amount or less on 6 treatments here than I would on a custom orthotic or any of the other devices that I've tried over the years to help me with the pain. And to be without pain like this, it's worth every penny.
Plantar fasciitis is particularly responsive to the MLS therapy. Also, neuropathy is very responsive, and to the point where we've had patients after 1 treatment who said they can feel their foot for the first time. It's very impressive.
This laser can do not only pain management, it can help peripheral vascular disease, Raynaud's syndrome, peripheral neuropathy. So its protocols for multiple problems is phenomenal. It's definitely going to change medicine.
What is MLS laser therapy?
MLS laser therapy is a revolutionary treatment being used by doctors across the nation to relieve pain and reduce inflammation. One example, Dr. Richard Jacoby, one of America's leading foot and ankle surgeons, who has been using MLS laser therapy for 2 years.
It's a pretty amazing instrument. We call it the magic wand.
Another example is Penny Rao, who typically scored her foot pain at 9 out of 10 prior to MLS laser therapy.
Just being able to sleep, not having to take out the Motrin or a Vicodin or something to be able to sleep or just get through the day has really made a big difference. I think it's very reasonable for what it's done for me. The cost is like minimal.
If we can avoid a medication, have a laser treatment that's non-invasive, no side effects, very limited contraindications for patients that can't have the laser treatment, then why not try some? Why not try when the results that we've been getting are 90% plus?
One of an alternative medicine and surgery, a laser by far and beyond of any modality I've ever used in the physical therapy world, this is the best. Who have had treatments for years, and they have instant relief of pain.
And after going through the different scientific studies, a lot of them out of Harvard, I was intrigued by the impact this light energy has on the cells. And to be able to decrease the inflammation pathway and the swelling on a cellular level, it makes sense that you thereby decrease the pain. I put myself under this laser the day after we got it. I did my shoulder and my knee, and that night I realized that I had no pain in my shoulder or knee after 1 treatment. It works.
Physician Jean Santo has been trying to relieve pain for 20 years, using every medical tool available.
I use all kinds of injections, I use all kinds of medications, I refer out to multiple other specialists, and there always remained a number of patients that just weren't getting better.
Is that a problem to you as I move the hip around?
So I've always had my eye open for something that could treat those patients, and I think I found it. What makes the cutting edge laser unique is the multi-wave lock system. Basically, they've taken an 808 and 905 wavelengths and they've synchronized them. The tissue absorbs those wavelengths, and that light triggers metabolic reactions in the cell that stimulate healing, that stimulate reduced inflammation, and stimulate pain reduction.
One of Dr. Santo's patients is Lisa Knott.
Hi, I'm here for my appointment today at 1 o'clock.
She has suffered from debilitating back and hip pain since high school.
The pain is absolutely immobilizing. I cannot, even at times, get out of bed.
After trying nearly everything else, Lisa recently began treatment with the MLS therapy laser.
The same day that I have my treatment, I see significant results. My pain is definitely less, and I have more mobility. When you're talking about your quality of life, there is no amount of money that you can put a price tag on that. Your quality of life is important. And if you can't travel, if you can't work, if you can't go to the movies and sit for 2 hours.
Knee pain, ankle pain, neck pain, pelvic floor pain, stenosis, you name it, it'll do it. It's just phenomenal.
It's really extraordinary, and I never would have believed it. I'm a very skeptical individual, and I cannot believe the results that I'm getting with my patients who had been operated on by me and others and didn't get complete relief from their symptoms, and now with the laser are really, really improved.
Even throwing a football, I can throw a football a lot better now than I could 2 years ago.
Within 5 minutes, the pain was gone, and I never had to have another treatment on my elbow again.
Even now, after several months, I have no pain in my knee.
It was like a mega dose of Advil and ice invisibly, and it was just amazing.
The laser helped me at a critical time in healing when I was literally bedridden with back pain, and it was just relieving the pain.
I would say I'm about 70% better than I was prior to the laser.
It saved my life. It saved the ability for me to be able to be flexible and to walk and bicycle and to be a regular healthy person instead of somebody who was 64 and getting old and getting unflexible. And so it made a big difference to me. Very big difference. It was the second treatment, and I walked out of here and I knew that something was different. And I called him back up and I said, "Thanks a lot. I think there may be something to this."
It has revolutionized our practice in that I can sit there and not feel like a failure as a physician, offer them something that has no downside, and these people are getting better. So every day I come to work, I feel like I have my ace in the hole.
Validated in clinical research, MLS laser therapy provides excellent patient outcomes across a wide spectrum of clinical indications. MLS laser therapy has optimized all the critical factors in therapeutic laser technology to deliver revolutionary results in considerably reduced treatment times while maintaining the highest level of patient safety.
Laser therapy uses a process called photobiomodulation to change the condition of damaged tissue by stimulating cellular metabolism, thereby accelerating the healing process. A large convex treatment head can be used to compress superficial tissues, displacing excess fluid and enhancing laser penetration to deep structures. As light pours into the tissue, photons will be scattered, reflected, and absorbed. Lasers operating in the near-infrared spectrum from 650 to 1300 nanometers can penetrate to deep tissue structures. Light that penetrates into the tissue can be absorbed by melanin, hemoglobin, oxyhemoglobin, and water. Energy from these absorption events will be dissipated as heat, generating a soothing warmth in the tissue. The primary target for photobiomodulation is the cytochrome C complex, which is found in the inner membrane of the mitochondria. Cytochrome C is a vital component of the electron transport chain that drives cellular metabolism. As light is absorbed, cytochrome C is stimulated, leading to increased production of ATP, the molecule that facilitates energy transfer within the cell. In addition to ATP, laser stimulation also produces free nitric oxide and reactive oxygen species. Nitric oxide is a powerful vasodilator and an important cellular signaling molecule involved in many physiological processes. In concert, the production of these signaling molecules has been shown to induce growth factor production, to increase cell proliferation and motility, and to promote extracellular matrix deposition and pro-survival pathways. Outside the cell, Nitric oxide signaling drives vasodilation, which improves microcirculation in the damaged tissue, delivering oxygen, vital sugars, proteins, and salts while removing wastes. These mechanisms of action have been proved by over 40 years of laboratory experiments using lasers of minimal power. The recent development of higher power Class 4 systems affords the clinician the ability to efficiently deliver adequate doses of light deep into the tissue to reduce pain, reduce inflammation, and accelerate healing.
A healthy cell functions much like a well-run factory performing its job. This includes making cellular products like connective tissue, hormones, and building blood vessels. When a cell is injured by trauma or inflammation, its mitochondrial batteries overwork to exhaustion. This causes the cell to become dormant, essentially going into hibernation. Our cellular mitochondria respond to specific frequencies of light, much like plants react to ultraviolet from the sun. The MLS deep tissue laser penetrates to a depth of over 2 inches, stimulating the cell's photoreceptors. This restores normal energy and function and allows healing to take place. The cellular factory returns to work, resulting in healing of both recent and old injuries, reduced inflammation and swelling, improved vascular and lymphatic circulation, increased range of motion, decreased pain level.